Hey guys, I'm Dr. Josh, and today I want to talk about COVID-19 hospital protocols, what you should expect when it goes to the hospital, and some tips, tricks, and things that I would recommend when it comes to the hospital. Because I've had some people ask me, and I have some friends that are expecting that said, what is the hospitals like? So I will do everything I can to cover everything in one episode, so this way you don't have to keep coming back. I'm sure I'm going to forget something, but that being said, guys, tricks, tips, things like one thing that was absolutely important that we packed was some sort of Bluetooth radio. You never know how long labor is going to be. My wife had labor for about 33 hours, and she was about pushing for about 2.5 hours. So music was really important to break some of that schedule, and we kind of just streamed right off our Wi-Fi or the hospital Wi-Fi with our phone. And it was really important, and it was actually good because it gave some energy, and we could change the stations. And when there was times where you need more upbeat, we can put some more upbeat music and stuff like that. So that was really important. One thing that I wish I did pack that I did not was a cooler. It doesn't matter if it's small or large, but something like with actual ice in it, and we can just have some food, or like make some burritos or something like that, freeze them and then throw them in there, because I spent like $400 at like a DoorDash. Not that DoorDash is great, Uber Eats, whatever you want, whatever food delivery service you choose for them, because I didn't want to eat the hospital food. And by the way, our hospital only gave food to the patient, meaning my wife. They wouldn't give it to me. So you need to realize that if you're the guy, or if you care about your significant other, that one thing is true, that like you need to eat, right? It's good for both of us, and if you don't have the food, you're gonna end up spending money on it. So that being said, you can't leave the hospital. You still can't have like one person go and come and another person. So it's one person there, one visitor the whole time, and that is that. So let me readjust a little bit, my sweetie. Okay, so that's that with it when it comes to food and stuff like that. Like, I spent $400 on food. Now, it was good to have like fresh food, but I'm not gonna eat hospital food. I was not, and my wife barely ate the hospital food, and as well, because it just wasn't as nutritious as it should be. So especially if you're breastfeeding and stuff like that, you want to be able to give good nutrients to your body for healing and for your daughter or your son. So that being said, with terms of one thing I didn't bring that I thought, because we were like on the rush, like just like, you never know when your water's going to break. You never know when things are going to happen. You never know when you're going to go. Even though we were packed 100%, I didn't bring masks. I only brought like one mask for each of us, and that was in the car. And that was really, really stupid. Because they don't provide masks at the hospital. So if you have one mask, you're going to have to be forced to reuse it over and over and over. And the policy is essentially you have to wear it 24/7, even if you have your own room. Now, yes, did we take it off? Of course we did a little bit, but like to eat and to drink and to like shower and do things. But it was very highly recommended that you keep it on at all times. And so, after 6 days in the hospital and 5 nights, like, my mask started getting dirty. It started to smell really bad. It was itching up against my beard. So I wish I would have had multiple, masks, both for myself and for my wife. And we just didn't have that. So yeah, and those are some things that I would definitely pack in your go bag, or your bag that you have, so that you can, have them. I do, like, most of the nurses and doctors were wearing surgical masks, not N95 masks. So we were wearing N95 masks, which means they're thicker, they're harder to breathe in and stuff like that. But, if they're wearing surgical masks, I would wish that I would have brought surgical masks more specifically. So it doesn't need to be like the KN95s up there or anything like that. I use those when I see patients, but I tend to just think that if we would have just had surgical masks, that would have been better, because they're easy to breathe out of. So that's one thing. In terms of COVID testing, they screen me every day when I leave and come and go. And screening is very simple. It's like, hey, do you have this symptoms? Okay, get us tag. Okay, go to the front, check in. As for my wife, you don't really need to go in and out in terms of that. So like, if I went out to grab the food or the coffee from DoorDash or Uber Eats or whatever, then guess what? I would have to rescreen them every day. So my wife did not, because she didn't really leave. And when she did leave, she had the wristband that said she was a patient. So patients, mothers in our hospital were tested, just so you guys know. Yeah, so they were tested, and the reason they're tested is obviously the doctors and the providers are treating that patient, the pregnant woman. And in this case, if your wife or your significant other is pregnant and has COVID, you will likely be taken to a different wing, so that you can be treated a little bit differently. Literally, the doctor told us, said, listen, if she was positive, they would be dressed in something completely different, almost like space outfits, I'm assuming. You know, I mean, so that's like that regarding COVID-19 and testing. So they do test her. You get the results about 24 hours later, but you know, they do it as soon as they can, so that they can check in and get that result. Because if you give birth after 24 hours and you find out, you know, you're positive, you're going to be taken somewhere else, likely to a different area to give birth. So really, that is a bit of a in a nutshell when it comes to COVID-19 hospital protocols. Again, you really can't leave. So when we stayed there for 5-6 days, we were literally like, we barely took walks, we barely did anything. You know, we barely left the hospital. And when we were in the NICU for about 2-3 days, we were actually in a little area where you couldn't even leave at all, like barely, without coming in and going and washing your hands every time, which is great. Like, that's awesome, that's fine. But you know, you couldn't even bring food in there. You know, you can't bring flowers in there. It's a very sterile environment. So you don't know what situation you're going to go into. So if you have food in the car, if you have stuff in the car, like, it's actually like really good that you can just like leave real quick, go to your car, because you're allowed to do that. But you just can't like leave the premises really and then come back. Now, I don't think people would know, but I'm not going to take that risk. And you don't want to leave your significant other while your child's being born. So that's one thing I wish I would have done. Trying to think what else, you know, that you would really kind of need. I don't think you need much. I reused my, like, they do have showers there. I showered like 2 or 3 times. So, you know, you just don't know how long you're going to be there. We thought we were going to be in and out just like most people, like 2-3 days. And we were there for 5-6 days. And in the NICU, like I said, there's no food allowed. So, you know, there was a couple times where there was during a shift change, I left to go get some food, and then like they wouldn't allow me in for a half hour, and the food got cold. And so it's just like, you know, it's part of just protocol and things like that. So you have to be flexible, adaptable. And if you have more stuff in your bag, in the house, in the hotel, in the hospital, you would really have a little bit more things. But you can bring food into like the delivery rooms. You can bring food into other areas, but not NICU. So that's something to just definitely note, and to understand that, you know, the more food you prepare now and freeze it, whether it's burritos or you know, sandwiches or whatever, and then you can just throw it on ice or in a bag, you know, in your car, because you're gonna end up spending a lot of money on food. And that's what we did, and that was like a frustration right there, because I was like, I can't get food, and you know, I need my energy. And even as a guy, like, I had to skip some meals in order to be prepared and present for my wife and my daughter. So like, with, you know, I want to know what was going on, so I just had to skip food and meals, and of course sleep. And so but in terms of COVID, you really don't expect to leave. Don't expect to be provided with any protective gear, because the protective gear is for the staff and the hospital staff, not for you. Okay, it's because they're seeing the patients. You're like kind of essentially self-quarantined in a room, and they need the gear. So I would pack extra masks, pack a cooler, pack things for you, because, you know, it's okay to order DoorDash and stuff like that. And I keep saying DoorDash, like, I don't want you guys to think I'm like promoting them. I just hopped on that because that was the first thing that I just downloaded on my phone and got set up. So, you know, but typically wives will get tested. Typically the significant other will not. My baby did not get tested. So if you guys are concerned about that, typically the baby doesn't get tested at our hospital. So, you know, but don't expect to leave, you know, really just expect, like, I don't want to say worst case scenario that you're there for a few extra days. So bring extra food, and if you have to order, that's okay. But if you don't have to order, at least your food stays cold in a car, in a trunk, in an ice chest, or a cooler, and you really have it ready to go. But definitely one thing I really stress enough, like, bring comfortable clothes. Definitely bring extra masks that you can breathe in, because literally I can't even tell you how bad, like, mine smelled. It's like, it was almost like having a mask that was worthless because it was so smelly and so dirty. And, like, I had to wear it to the bathroom, I had to wear it in the delivery room, I had to wear it to go pick up food, I had to wear it inside, outside, different floors, and, like, it's like you're talking about a sterile environment in the NICU. I'm like, that mask was probably dirtier than anything at all, and we only had one of them, and they just won't give you anything. So definitely a eye-opener, and definitely some things to take a look at. I think I covered everything. So if you have any questions, let me know. I'm sorry I'm not speaking up as much. I'm trying not to wake her. I got some good advice from the nurse, and the nurse said never wake a sleeping baby. So I'm doing my best not to do that. And you know, we're just really grateful that everything came out okay. We are good. She is good. My daughter is good. It's so amazing that the situation that you're put into, and how you come out of it, you know, stronger together as a family. And it is frustrating. There are things that you're concerned about, but, you know, if you prepare yourself ahead of time for these situations, like, you know, like I said, you know, having more food, more clothing, comfortable clothes, or whatever it is that soothes you. Like, I can't even tell you enough, the music was like lifesaver. Music was absolutely lifesaver. Like, if that's all I have to say about that. So music really helped, especially if you have a long labor like my wife. You never know how long it's going to be. So anyway, guys, that's it for today. That's really what my experience with COVID-19 is, and the hospital system. It was very sanitary. It was great. You know, everybody took the precautions. All nurses, doctors were on staff, were good, and, you know, very hygienic, and changing gloves and changing everything for such a long period of time. It was great. But, you know, it was just something that I didn't prepare for, and I wish I did. But it's okay, because I'm home now, and we're healthy, we're happy, and we are good to go. So if you have any questions, let me know. I would be happy to either do another video or answer them directly. But this is kind of like the current situation in hospitals. I don't think it's going to change anytime soon until we find a vaccine. So I think this video here that I'm talking about and shooting for you guys is going to be very relevant, not just today, tomorrow, next week, or even next month. It may even be more just as relevant next year. So that's it, man. That is it. We're really happy to have healthy family together, and thanks for watching this video all the way to the end. But thanks again, guys. If you have any questions, please let me know. I'll see you guys soon. Bye.